Good day and welcome to today's program of On Call. Thank you so much for joining with us for another program. It's a pleasure to have you here with us. As usual, I have with me our resident doctor, Dr. Maxwell Adeyemi. Dr. Max, welcome to the program.
Thank you. Nice to see you again.
Yes, it's nice to see you as well. And I know you're usually a very busy man, and so, we have to just grab these moments when we can and take full use of them.
Sure.
All right, so we're going to be continuing today. We started a topic about 2 weeks or so ago talking about feminine hygiene, issues that affect feminine hygiene.
Yeah.
So on our first program, we dealt with yeast infection. The second program, we dealt with, remind me, Dr. Max, my memory is slipping.
We did chlamydia.
We did.
And other kind of vulvovaginitis.
Right, vulvovaginitis, that was it. And so for today's topic, we're going to be looking at vaginal discharge, because coming out of all of the programs that we've done so far, we spoke about different types of vaginal discharge that people should look for to know, if something might be wrong or so. And as usual in my discussion with some of the young ladies, what is that? What does that mean? And so on and so forth. So today we're going to be looking at, we're going to be discussing a little bit about vaginal discharge and how it affects women, and what are some of the things that they should look for, what are some alarm signals, what are some things that, are normal and so they shouldn't necessarily worry about. So Dr. Max, before I talk too much, let's get started. Vaginal discharge as our topic today. What exactly is vaginal discharge?
Yeah, first of all, I need to also backtrack a little bit that this topic today was supposed to be the initiating topic, supposed to be the first topic that we should have dealt with, which deals generally with the issue of vaginal discharges, because for the past 3 weeks we have been looking at the different causes of the of vaginal discharges. Okay, there are up to about 20 different causes. Wow! So we're dealing with the starting topic today, which is vaginal discharges, and then after that we may continue with the other, situations and conditions in which you may have vaginal discharges. But generally, vaginal discharge is basically the liquid or clear mucoid substance that comes out of the female vagina. It is normal, to have that, and it's just a sign of a healthy vaginal area, because your vagina will have to produce certain substances, and the glands there will produce certain secretions and liquid that helps to keep the vagina not only moist but make the area healthy, to prevent certain kind of infections. So it is normal to have a vaginal discharge. Okay. However, the problem will originate if the color, the texture, the volume, and the other smell and other things that associated with the discharge deviate from what is the norm.
Right. So, so it's completely normal. It's healthy, and actually, it's a cleansing, a self-cleansing kind of mechanism going on there. So, with that being said, is it that all women have vaginal discharge?
Yeah, like I said, vaginal discharge serves as an important housekeeping function of the female reproductive system. So all women practically go through this, okay, in which you have the fluids secreted by the glands around the vaginal area, and they help to just not only lubricate but prevent infection. So all women basically go through this process.
If somebody, have you ever heard of, this is completely off topic, but, well, not off topic, of our questions as we discussed, but have you ever heard of anyone, any female who does not have a vaginal discharge? And is that, well, since we say all women, then that would obviously be something abnormal, but have you ever come across anything like that?
No, I've never come across any, and I've not seen any. All right, so everyone has some degree of vaginal discharge, okay, and the reason why is what I've just said, and And like I said, it's perfectly normal to have it, but when certain parameters by which we, assess them begins to change, then we start to raise some red flags.
Well, let's talk about some of the parameters, some of the things that would cause it to change. But before we get that, because in order for us to know that it has changed, we need to understand what is normal vaginal in terms of visual. What does it look like?
Okay. The normal thing is that it usually have this clear, colorless, sometimes we call it discharge, okay? And that could be affected also by different conditions, which does not necessarily mean that something is wrong. For example, at the height of sexual excitement, you may get vaginal discharge. When you're breastfeeding, when you're pregnant, sometimes emotional changes could also, create a change in changes in vaginal discharge. Even the period of ovulation as well, okay, that could happen. Even in some people, when they take certain kind of medication, that could also alter some of these things. That does not mean that something is drastically wrong. You just need to know exactly what is happening at that point in time and be able to interpret what is going on correctly. Okay, yeah, basically.
So, right. So, that's what it looks like normally.
Yeah.
You mentioned some, but I know you said there's a whole long list. So what are some of the other factors that can influence a change of color from what it should normally look like?
Okay, I'll answer your question first by letting you know what are the things that you look for that will signify danger. Okay, if the vaginal discharge changes in color, maybe it starts to get yellow or green or red or whatever, the color changes, that may be a danger sign. If the quantity also changes, I mean that it becomes copious and heavy and whatever, then you know something may be wrong. If also the texture changes, instead become either more watery or more thick and more, viscous and stuff like that, it may be a sign that something is brewing. If also the odor changes, okay, you start to smell in a particular way, then we raise a red flag. All right, so those are the major things by which we can actually assess what is going on and be able to say, okay, look, I think you need to get this checked out. Okay. Yeah?
Right. Good. So what are some of the other factors? You said you would ask. So yes.
The causes then, okay, may vary. Okay. Like we've been saying for the past few weeks or so, antibiotic use is one major cause of vaginal discharge in some women. Okay. Especially some antibiotics that may trigger yeast infections, okay, and that will cause a discharge. You could have bacterial infections, okay, like in situation we have bacterial vaginosis. So these bacterial infections, okay, we alter what is going on. And then because of the pH of the vaginal area that changes also, that may also prompt the growth and multiplication of certain type of bacteria, okay? And during pregnancy, that area is also affected in the sense that the dynamics of the acidity and the alkalinity also changes. So that could also, lead to vaginal discharge. Then you can have birth control pills. Okay, when people use the oral contraceptive pills especially, they could have some of those issues. Certain disease conditions like cancer, okay, especially cervical cancer is a major cause of vaginal discharge. In this case, there may be a little bloody kind of discharge that you see. Okay, you have also gonorrhea that is caused by a bacteria called Neisseria gonorrhoeae. You could have chlamydia, or those bacterial infection, they do cause that. People who are diabetic could also have increased tendencies to have vaginal discharges and vaginal infections. And people who use scented materials and dolces and things that may alter the, basic composition of the vaginal area, that could also be a problem. Okay, people who have pelvic inflammatory disease, maybe following surgery, that could be an issue. All right, and those are some of the cases. Emotional stress, like I told you, emotional changes and stuff like that. Okay, yeast infections, like I said, vaginitis as well, like we said, vaginitis, which means irritation and inflammation of the vaginal area, and also menopause. Menopause is another big cause, because we are what we call the postmenopausal vaginitis, which causes changes in the structural anatomy of the area, because the vaginal area becomes atrophied and loses its ability to produce some of these secretions that keep the place healthy.
I know you mentioned last time that as we continue in our discourse, there's some things that remain constant, and I'm sure this is the case as well. So apart from, if someone suspects that they may have a vaginal infection because of the discharge, what are some of the other symptoms that that can also show itself?
Okay. All right. So I'll possibly just briefly use that question and address the issue of the types of abnormal discharges that you see, and
right, so that you know what is what.
Possible causes. Okay. Whenever you see any bloody or brown discharge, it may mean that your period is irregular, or less often, it may indicate some cancer, like cervical cancer or endometrial cancer sometimes. Some other symptoms that you may have with that will be abnormal vaginal bleeding and pelvic pain. So when those are all tied into the same symptoms that you're having, okay, you have this bloody or brownish discharge, you have postcoital bleeding when you have sexual bleeding, you could have a lot of abnormal vaginal bleeding from time to time, and you have pelvic pain, you need to get that checked out. So that's for bloody discharge. You could have cloudy or yellow discharges, which may indicate that you have gonorrhea. Okay, you have these, copious yellow, discharges. In between periods, you may also have bleeding, and you could have a lot of urinary symptoms, because some of the bacteria might get into the urinary system and cause bladder infections as well. Or you could also have a lot of pelvic pain, so a lot of lower abdominal pain. Whenever you have frothy, yellow or greenish discharge with a bad smell, that could also mean another kind of infection called trichomoniasis. Okay, this also has pain and itching, especially when you have to pass urine. Okay, when you have these thick, white, cheesy discharges, everybody knows that is a yeast infection. Okay, you could have swelling and irritation around your vagina with that, a lot of itching as well, and sometimes you may have burning sensation when you pee, and painful sex. Okay, because the area will be irritated and raw. Okay, now, but whenever you have a whitish, gray or yellow discharge with a fish odor, you smell very fishy, that is a diagnosis of bacterial vaginosis. Okay, that is also accompanied by itching or burning and redness and swelling around the vaginal area. So different vaginal discharges, the color, the texture and stuff may indicate different types of infections and different disease conditions that need to be addressed.
So then it is safe to say that as a female, you should at least know what is your normal discharge, what the normal discharge looks like. And therefore you should be able to identify
when there is a change.
Right, because you will know when your discharge looks like pre-menstruation, post-menstruation, and all of these different things. So anything that is outside of that, you should cite it as an abnormal discharge, and therefore
so everybody has to know what is normal for them.
Right.
So when there's a deviation from what you are accustomed to as being normal, then you need to check things out.
Get it checked out. And of course it is always wise never to self-medicate.
Preferably not.
Check with your medical practitioner first, unless it's something that you're familiar with, as you've discussed this with your doctor, and this is the usual treatment or whatever. But in wisdom, you see something, you get it checked out. You get it checked out first. Right, we're going to take a quick break at this time, Dr. Max. We're going to come back because we still have a whole lot more to talk about in terms of how it's diagnosed and treatment and all of these things. So that will be on the other side of the break. Don't go anywhere.
Dr. Jazz, the daughter of thunder, along with Reverend Karen Alexis of Oracle of Praise Open Bible presents Dancing with Broken Bones on Wednesday, 27th May at the Mount Grace Open Bible Church, starting at 7 p.m. Speakers include Minister Ivy McGregor, Reverend Karen Alexis, Elder D.B. Jevers, and Dr. Jasmine Scholar. For more information, please call 759-0471 or visit iamdrjazz.org.
Welcome back to today's program of On Call. Thank you so much for staying tuned and joining with us. As usual, we have our resident doctor, Dr. Maxwell Adeyemi, sitting in on set with me this evening. And we are continuing in our topic of feminine hygiene issues that affect feminine hygiene. And today's program, we are looking specifically at vaginal discharge. And as Dr. Max mentioned earlier, this should have actually been our very first program. But we're doing things kind of... We'll get it rectified by the grace of God, don't worry. So before we went to a break, we spoke about what exactly was vaginal discharge. We spoke about the fact that it's normal, it's regular, and as far as we know, every woman has vaginal discharge. We also spoke about what is normal vaginal discharge in terms of what it looks like, and then what is abnormal, and you know, what are some of the things that you should look out for to know that it has changed from being normal. So as we come back now, we're going to look at diagnosis, we're going to look at treatment options and so on. So Dr. Max, we just spoke about, and I know someone, as we had previously spoken about this and so on, someone that asked you what was the color of the green. You said, there's a yellowish, greenish kind of color. So, I mean, it shouldn't be green in the first place, but what does the yellow and green look like? If you were to compare it to an actual, is it like a yellow sunflower? Is it green like, I don't know, like the grass on the road?
Well, I guess that would depend on the individual
and
person and the severity of the things. And so the shades of green is not something that you can really say, okay, this is how it is as a standard color. No.
But it shouldn't be anything other than clear, whitish, right? So anything outside of that,
then there's a problem.
Right. All right. So how does a doctor diagnose that something is wrong with the vaginal, with someone's vaginal discharge?
The diagnosis of that will start with a proper consultation, which start with a history taking. Okay, so the doctor will have to ask you about your personal history, and possibly the history of the present problem that you're having. Okay, you've got a discharge, how long has it started, and what is the color, what is the smell, what quantity it is, and is there any smell, those kind of different questions the doctor will now have to ask you. And what other kind of sanitary practices that you engage in, if you do is douche, if you use other scented stuff, if you use tampons, so those kind of little bit of the history that the doctor will have to try to find out, to try to figure out what may be contributing to the problem. Okay, obviously your medical history will also be significant in this instance. Okay, if you're diabetic and if you have any condition that you're taking antibiotics for, okay, emotionally, okay, and what is happening to you and stuff like that. Those are the things that we need to find out, to assist the doctor in making a diagnosis. And once you get that, in some instances, the doctor might ask you to collect a sample of the discharge so that it can be analyzed in the laboratory, okay, and then they'll be able to grow using laboratory techniques what type of microorganisms may be present, so that will inform the type of antibiotics that will be used to deal with it. If it's a bacterial infection, if it's a parasite, there are other things to use. If it's a fungus, there are other things that you can use to treat these conditions.
Wow. So since you started on that, let's talk a little bit more about treatment.
Right.
What are some of the treatment options available for people with infections that result in different kinds of
treatments will also largely be dependent on what is the cause. Okay. If somebody is diabetic or they have a yeast infections, obviously we will use yeast antifungal medications to treat them. If we figure out, okay, it is as a result of bacterial infections, we will have to use some specific antibiotic to deal with the matter. If we suspect it has to do with your emotional state or stress level or whatever it is, then that matter has to be addressed. Whenever it is as a result of antibiotic use, most of the time it will be yeast infections, so we might now treat you with an antifungal after the antibiotic or maybe simultaneously just to prevent. Okay. In situation where you may have vaginal bleeding and discharges that as a result of suspected cancer situations, then that will call for a different kind of treatment and for a kind of screening entirely. And some of these could actually coexist together, because I have seen a patient who was pregnant and was having these repeated vaginal discharges and bloodies, whatever. And it is typical that you can actually, you know, think it is the pregnancy that is causing the vaginal discharge, you know. And unfortunately, she had cervical cancer. But the doctors could not do anything. Because she was pregnant. And until she delivered the baby, unfortunately, by the time she delivered the baby, the thing has spread. So it was a very kind of pathetic story, but those kind of things will happen at times, you know. So that's why it's always good that you keep checking. And do your regular checkups. And do a pap smear as well, so that situations like that you can pick it up and deal with it immediately. Yeah.
All right. I know as we spoke, I mean, there's a pregnancy and so on, and again I have to refer, you know, something that we would have said on a previous program. But if the person, the female in question, is married or so, then it also becomes necessary for them to get the partner.
Right. So that is another, you know, topic by itself, contact tracing and contact treatment. And that is very important, so that if you are married to somebody or you have a sexual partner and you pick up an infection, the logical thing is that the other person will have to be treated. So we have to ask you, who are your sexual partners, and those people will have to, you know, be treated with the same kind of medications or something different to treat what is going on. Because if you get treated and you get cured and you go back to the person who will have also contracted the same thing and has not been treated, the fact is that you will get reinfected again. And sometimes, depending on who is, maybe male or female, persons may actually be carriers, in which case they are not manifesting the symptoms per se, but they have it. And this is common especially in women who have chlamydia. And chlamydia is pretty rampant. Okay, so you could carry chlamydia for months, for years, and occasionally it may, you know, reactivate again, and you could, you know, get it transmitted to somebody else if you're having unprotected sex. So the best thing is for you to make sure you protect yourself at all times.
We're talking, okay.
Yeah, if you're married.
Well, yeah, because I was kind of stunned a little bit. Yeah, because that scenario just, that name crossed my mind. But you know, I know this is true, especially. Well, I don't know if it's still true. I've been out of touch with lots of things lately, but I know in terms of it's more likely that a female will get tested for something if they figure they're in, you know, they may have some issue, as opposed to men, because you know, this whole macho egotistical thing. But have you ever experienced any? Have you come across women who are also afraid to, you know, they may have, let's say they have an infection of some sort, the vaginal discharge, but even Sometimes they may present themselves to the office, they may go to see a doctor, but they're still afraid to open up, to really share. They, is that typical? Is that normal?
Well, that is another kind of topic again. That we talk about assessment or assessing healthcare services. Most of the time, in most categories of disease and illnesses, men are always reluctant and women are always more willing. So in a particular case, maybe you have 100 people assessing a clinic, maybe about 70 of them are actually females and about 30 are males. That is consistent, be it diabetes, high blood pressure, or other female problems or reproductive problems or whatever. That is a standard thing across the board. And it's not only in Tobago Island, that is most likely even worldwide. Okay, so, and what you will now have to do is to talk whoever it is to get the other person to come. Some women are open, okay, because there are tendencies that women are a little more conscious about their health, so they are almost more eager to find out this and find out that. But you've got some situations in which women get a little reluctant, and when you talk about reproductive issues and things that have to do with this kind of situation, a lot of people are either reluctant, they are uncomfortable, they're possibly more comfortable with certain type of persons or type of healthcare providers, you know. So that is something that is based on individual preferences. You know, many women will be more comfortable with female doctors. Okay, even they are not to do the pap smear and other things, they're comfortable, and that is their enshrined choice of preference. You prefer who you go to. And even if you get to a clinic and somebody is there and say, okay, well, I do not want to see this person, it is your right to make that choice. Okay, so you can say, okay, I prefer to see this person. And there's some people, they prefer male doctors because they figure, okay, well, look, I'm more comfortable talking to a male person, okay, because maybe their experience or their own perception about female is this, whatever. People have different kind of permutations as to who they prefer. Okay, so, but by and large, women do assess healthcare generally more than men, and especially in issues like this. And I've seen situations in which women get the thing and we're trying to treat the partner, and the partner turns it into a fight and it's a quarrel and it's not shit, but you still have to get treated. But
I was going to ask just quickly, because I mean, we're out of time, we have to wrap up, but I once heard of a scenario where the female, you know, in the marriage, the female went and got treated, you know, realized whether this was the case and they forgot the prescription. However, her spouse now wanted to take the same prescription to treat themselves. Is that, shouldn't, I mean, would the dosage be the same if they had, is that shouldn't even happen? Because I'm just thinking that if you're prescribed 10 pills and it has to go for 5 days or whatever, and here is your partner pulling from it, then you'll end up in a case where you probably won't be treated properly. You'll have to go back to the doctor. You might get a flare-up again. I mean, there's so many things.
No, sharing the medication could be a dangerous thing, especially when you say that, okay, they've got for 10 days, or maybe for 5 days, and somebody take for 3 days and another take for 3.5 days. That will constitute improper treatment and incomplete management, and that could create resistance, drug resistance to the medication. So it is not advisable to share medications. You get your own full dose and full course of the antibiotic or any other medication that is given to you, and complete your dose and complete your course, maybe 3 days, 5 days, 10 days, or whatever.
But get your own meds.
And get your own thing. It might be the same medication, but the doctor will have to write for you using your name, and then you write for him using his name, just in case there's any problem with the medication, because sometimes what you take, he may be allergic to it. And that too. So there could be other different kind of situations. But sharing medication and taking half of what is given to one person is surely a very dangerous thing to do, because that is where drug resistance may come in.
All right, Dr. Max, thank you so very much for your time. All right, viewers, thank you for tuning in. Dr. Max, is there anything, we way out of time, but is there anything, you know, final couple seconds, parting words you want to leave with our viewers, just, you know, just before we go?
Well, like I said, if you notice anything different that you're not comfortable with, it is better you get checked it out, especially females, anything to do with a lot of bloody discharge or whatever, because that case that I discussed with you stuck with me for a very long time. We thought the lady was pregnant, she got a bloody discharge, only to end up that she has cervical cancer, and it was just too late. Yeah. So
viewers, female viewers especially, know yourself, know your body, understand what's going on, and if there is anything that looks abnormal, out of the ordinary, please visit your healthcare professional as soon as possible. Thank you all so very much for staying tuned to today's program of On Call. We're going to see you next week, same time, same place. Have a good evening.